I've started your timer and here is your question. Right, so if you have read and understood, considering it history taking station, please begin.
Hello.
Yeah. Hi.
I'm Dr. Ulfat. I'm one of the surgical doctors working here. Can I please confirm your name and age?
My name is Mr. Allen Jack. I should be in my 70s.
Okay. Can I call you Mr. Erlin?
Yes, you can.
Okay. So, Mr. Erlin, I believe you are scheduled to undergo an operation today. I've been asked to ask you a few questions to assess your memory. Is that all right with you?
Okay, go ahead.
Okay. So, could you please tell me how old are you?
Well, I should be, well, I'm not quite sure, but I should be 70 years.
Okay. And could you tell me what time is it to the nearest hour?
It should be 20 minutes to 12 midnight.
Okay. I want you to remember an address that I will say. It's called 24 West Street. Can you repeat that for me? 24 West Street.
24 West Street.
Yes, now I want you to remember that because I'll ask you at the end of the questionnaire, okay?
Okay, you can go ahead, doctor.
Okay. So can you please tell me what year were you born?
I was born in 1970.
Okay. Can you tell me where are you at the moment?
Okay, I'm at the hospital.
Okay. Can you please tell me who am I?
Okay, you should be you are the nurse.
Okay. And do you know the person standing beside me? What is her job?
Okay, she should be the porter. She should be the porter.
Okay. Can you please tell me when did the Second World War end?
Okay, I think it ended in 1945.
And do you know who's the current Prime Minister of Britain?
Sunak.
Okay. Mr. Erling, do you remember the address that I'd asked you to remember? Could you please tell that for me?
Okay, the address you told me earlier was 24 West Street.
Okay. Is there anything that you would like to ask me?
Count backward.
Not really.
Okay. Can you please count backwards 20 to 1 for me?
Okay. Should I count from 1, 2, 3?
No, from 20 to 1, backwards.
Okay, from 20. Okay, 20, 19, 15, 13, 11.
Okay. Okay.
7.
Okay.
I'm not sure of the others.
All right. It's all right. Can you please tell me what do you think what could be happening to you at the moment?
My daughter actually brought me to the hospital today. She told me that I'm supposed to have a surgery, but she hasn't explained to me what the surgery was for.
Okay. Are you concerned about something here?
Well, it's just that I need more explanation about what they want to do for me. I'm not quite clear what they want to do for me. I'm not clear on what they want to do for me.
What would you like us to do for you? Is there any way we could help you out?
I want more explanations to what is intended to be done for me, and then what the surgery. I want to be explained what the surgery that they want to do for me. What's the reason for the surgery that they want to do for me?
Okay. All right, Mr. Erling, thank you for your time. I will speak to my consultant and I will get back to you, and hopefully we can help you out here. Yes?
Okay, thank you so much. Thank you so much.
Thank you so much.
Okay, you had still 40 seconds, but then can you summarize your history now?
I've taken history from a 76-year-old man, Mr. Erling, who's come for an elective right inguinal hernia operation, but he is presented with he's been presented with confusion, and on history, the patient's abbreviated mental test score is less than 6, which
signifies
shows that the patient might be in an acute confusional state or maybe suffering from dementia. But I do have some differential
short-term memory loss, not the
short-term memory.
Yes. Okay. Yes.
But I do have some differentials, like it could be an electrolyte imbalance or from some infection, or maybe infections such as urinary tract infections or upper respiratory tract infections, and or hyperglycemia.
Okay. How do you suggest this patient should be managed?
Okay, management of this patient would be after thorough history taking. I would like to do a clinical examination of the patient, with special attention to his blood pressure, his vital signs, and then I would like to speak to his relatives, and I'll also check his general practitioner's notes. Good. I would like to do some blood tests, which would include the full blood count, urea electrolyte, liver function test, blood glucose level, urine for dipstick for routine examination cultures. I would like to do a CT scan of the brain. I would like to do a chest X-ray and ECG, and also vitamin assay like vitamin B12 and folate assay. I would check for thyroid function test and serum calcium levels.
Yes, and you'll consider what?
And
you'll ask the medical registrar. Yes.
Then I will consult with my consultant surgeon, and I will also have to inform him regarding the patient's condition at the moment and possible postponement of or cancellation of the operation. And I will also seek advice from the anesthesiologist, and after consulting with my consultant, I would request the operating team to cancel the listing for today.
Why are you convinced that surgery should not go ahead?
Because the patient does not have the capacity to retain information and give an informed consent to the operation at the moment. And I'll have to assess that. If I see that the patient is having an organic cause or a cause that can be treated, then I would like to treat that first and then go ahead with the operation.
Okay. But here it says that you have to consult with your consultant and anesthetic before you cancel the procedure.
Yes, ma'am.
Yeah, good. Okay. Thank you.
Yes, ma'am.